afternoon, I guess it is now. Sometimes we have to stop and think what time of day is it. This is COVID time, so sometimes that gets a little messed up. But I'm glad to be here with you today. And we have with us today a very, very special guest, as you can see, and her name is Carol Head. And Carol is one of our Villager Award recipients too. We're trying to interview all of our past Villager Award recipients, and so we're really happy to have her. She is actually right now in one of the colder states of the United States, Minnesota. So, and I'm here in Southern California, so you can see I'm wearing yellow and she's wearing black, and that's probably why we're in two different temperature zones here. Hello, Carol.
Hi, Gloria. How are you today?
I'm fine. How are you?
Well, staying warm.
Okay, that's a good thing. That's a good thing. That's definitely a good thing. I've known Carol now actually for several years, and it's really an honor to have her here with us today and to be able to just let you meet her and to have you learn just a little bit more about her. This woman has had such an amazing life journey, and I wanted to share some of that with you so that you can get to know her as one of our villagers. We're really proud of that. Carol has been with us for many years now. In fact, Carol started with me on the Village Projects when we first went to Ghana. And she is the one, there's always one that comes out of the group, who has been with me almost every time that we've been back since then. And I'm sure you get to hear a little bit more about that. But not only has she been there all the time on these Afram journeys, but when she is there, she has been so important to us in that she has created this relationship there with the health clinics there, the community health center there. And as you know, relationships are everything, everything. And she has created the relationship, a trusting relationship, a credible relationship, which makes it easy for us to just walk in there and to be greeted warmly and to have, we start to set things up so that when we do get to the point where we can send large numbers of volunteers there to that health center, trust me, you will be welcome. I have no doubt about that. And we owe that to Carol and to her ability to make those kinds of connections for us. Carol was also one of the first of our volunteers to be there at the very first meeting of the Women's Empowerment Group there in Senyaberu, Ghana. And that has turned into a very historic group now over the years. They're an organized group. In fact, somewhere along the line, you'll probably get to meet some of these women because we will be interviewing some of them for you. But I just want you to know that Carol is one of our history makers. And I just want you to know that. So, Carol, that was my introduction. Okay, so with that piece of the introduction, I want you to just tell us a little bit about yourself. Where you're originally from, because you're from so many places now. Where you're originally from, and anything you want to share with us about your childhood growing up. Let me just hear you.
Well, originally I am from Detroit, Michigan, which is where I was born and grew up. And just as an aside, I got into nursing because my mother was a nurse.
Oh,
And yes, and so that kind of led me in that direction very early in my life. But I slowly moved out of the Detroit area after I got married, first to Michigan suburbs of Detroit, then to um, Ohio, and then Maryland and the DC area. And from there, I was when I started my international travels from the Columbia Hospital for Women in DC. I left there and went to Saudi Arabia for 3 years on my first um, visit there. And it kind of bothered me, which I was quite surprised that I didn't have a place to call home because I had sold my home. Unfortunately, I'd gotten divorced, sold my home, and then went to Saudi Arabia. So I only stayed 3 years. And when I came back, I moved to New Mexico, primarily because of the weather. It, it had the reputation of having sunshine, blue skies and sunshine 333 days a year. but it does have a bit of a change of seasons, which I liked because but I didn't want 3-month winters. And I came back to, when I came back to the States, moved to New Mexico, and it was there that I got my graduate degree in nursing. And once I had done that, then I went back to Saudi Arabia, which is where I met Dr. Gloria.
Yes.
She came over as director for our education department at the hospital where I was working at the time. And
Yes.
from there, we've been great friends ever since. We stayed in contact after that meeting, and that's kind of me in a nutshell. But while I was in Saudi, one of the reasons that I went was so that I could travel. And
Yes.
so during the 10 years, total 13-year span that I was there, I traveled on average every 3 to 4 months for several weeks, and really gave me an opportunity to see the world and experience other cultures. And because I'm not a 5-star hotel kind of person, I like to live on the economy and see how the people from the area live.
Yes. Yes. Well, tell me, Carol. Give us just a snippet. What did you do when you were working in Saudi Arabia? Exactly what kind of work did you do there? I know your reputation as a leader there is very well known. So tell them a little bit about what does a nurse, uh, not just any nurse, but a Carol head nurse.
Well, when I went the first time, I was actually a bedside nurse in labor and delivery.
Uh-huh.
And when I went back to Saudi Arabia after getting my graduate degree, I went back initially as the head nurse for labor and delivery and postpartum. And before I got out of orientation, they asked me, would I take on responsibilities for the OBGYN clinic and the infertility clinic. So I did that for a couple of years. And then at the repatriation of the director for ambulatory care services, I was offered the job as director of ambulatory care services, which was a real learning experience for me. And that was my first real job in real, high level, nursing leadership.
Yes.
Um, because I had 15 clinics with 55 subspecialties. I had acute and chronic dialysis, home care, and I tell you, I learned an awful lot about not just how to manage well and, direct that many different areas, but I obviously had good leadership in all of the clinics. And then, when I came back to the United States in 2008, actually Dr. Gloria's fault that I'm doing what I'm doing, because I told her when I was getting ready to come back, I said, Dr. Gloria, I really want to work, but I don't want a job. And so at that time, she told me about a company called B.E. Smith that was doing interim leadership positions. I contacted them. And so for the past 12 years or so since I've returned, that's exactly what I've been doing. And I've been traveling around the US. Although I have to say, since I came back, my focus has really stayed within the maternal child field, which is, where my clinical expertise was. And that's kind of where I am now. Thank you, Dr.
Exciting.
Gloria, because I
Oh,
love what I do.
good, good. It was you. It was you. It was obvious to me, given your worldly experience, your global experience, and that you needed to have an opportunity to sort of spread your wings. I just could not imagine you staying put in just one place. I think you're so much bigger than any one place. You really are. You
Well,
really are.
it's been a very positive experience for me. And one of the joys of doing what I do now, traveling within the US. I mean, well, there are two things. One, I get to see places I probably never would have seen otherwise,
Mhm.
because I will tell you where I am here in Minnesota was not at the top of my list of places to go, particularly
Right.
in the winter.
Yes.
But I found that doing what I do and getting experience with different facilities kind of all over is that I really can relate to the issues that really are spread throughout the country. No matter where you are, the issues are pretty much the same, to different degrees often, but still pretty much the same. And the other thing is that it really gives me an opportunity not only to mentor young nurses coming into the field, but also to help more experienced nurses to accommodate to all of the change that has gone on in healthcare over the past 15 years, really.
Hmm.
And to get them, I found that in talking to them and showing them how the changes are not just because somebody said so, but that they're evidence based, and it really will help them to deliver, safe quality care to their patients. And once they can connect that to the patient, then they're much more adaptable to the change and
Yes.
buy
Yes.
into it, which is
Yes.
important.
Very, very important. So let me ask you, Carol, given your experiences and all over the world and over the country, what advice would you give to a young nurse, a new nurse, about sort of the benefits or what you think you got out of that they might want to look into? What do you think was one of the greatest benefits of having those kinds of experiences?
Well, I think one of the greatest benefits is recognizing that the issues that healthcare that you have in delivering, safe quality care for
Hmm.
patients is pretty much the same no matter what where you are.
Hmm.
People have the same issues. Whereas, initially going in, everybody thinks they're the only ones that are experiencing this. And
Hmm.
that's not true. Depending on not only where you are in the US, but even internationally, there are nursing shortages in a lot of areas, or there are shortages in specialty areas. There are equipment issues. There are issues with, administration and how to to bridge that gap between the nurse at the bedside and the people in the C-suite.
Hmm.
And getting nurses to understand is that the people in the C boy, tongue tied. The people in the C-suite and the folks in, finance that give you the funds for the things that you want do not understand. They don't care how you feel. What
Hmm.
they understand is data. And in order for you to get the things that you need, you have to be willing to collect the data to show the need. Because
Hmm.
ultimately, they want to provide safe quality care too, because that's how they're reimbursed. If
Right.
if the quality of the care for facility is deemed to be unacceptable, then they could lose Medicare um, uh, their Medicare
Reimbursement.
reimbursement. There are a lot of negative things that can occur in an institution that doesn't have a reputation for delivering quality care, and that they can identify it,
Hmm.
looking at their patient satisfaction scores, those kinds of things.